will discuss findings from a phase 3 trial evaluating a novel radio-labeled hormone therapy for the treatment of mid-gut neuroendocrine tumors. Dr. Jonathan Strasberg, a medical oncologist at the Moffitt Cancer Center in Tampa, Florida, will present the results.
Thank you very much. So it's a pleasure to present the results of the METEOR-1 study, which is the first randomized phase 3 study of a radio-labeled somatostatin analog. Next slide, please. So as a way of introduction, we discussed the fact that there are very limited therapeutic options for patients with neuroendocrine tumors who progress on first-line somatostatin analog therapy. Yet, for the past decade, primarily in Europe, thousands of patients have been treated with a form of therapy known as radio-labeled somatostatin analog, also known as peptide receptor radiotherapy, PRRT, with exceptionally promising results. As you can see from this table here, there have been several generations of radio-labeled somatostatin analogs, including yttrium-90 and lutetium-177. And what this treatment basically involves is attachment of a radioactive isotope to a somatostatin analog that can thereby deliver the radiation in a targeted fashion to tumors that express somatostatin receptors. And the very large majority of well-differentiated neuroendocrine tumors express very high concentrations of somatostatin receptors. Lutetium-177 is the latest generation radioisotope. It's a beta and gamma emitter, has a relatively favorable therapeutic index compared to the previous generations. And you can see from this table that the median progression-free survival in early phase data has been exceptionally promising. In one large study from Rotterdam published in the Journal of Clinical Oncology, the median PFS was 33 months. Next slide, please. So the METEOR-1 study was the first trial to test this in a randomized prospective fashion. The patient population consisted of patients with mid-gut neuroendocrine tumors. These are tumors originating in the small intestine and proximal colon. This is the most common primary site for advanced neuroendocrine tumors, and that's why this population was chosen. They all had to progress on standard dose somatostatin analog, specifically sambostatin LAR 30 milligrams. And they were randomized to an experimental arm of lutetium octreotate, now known as Lutathera, versus high-dose octreotide 60 milligrams, which is twice the standard label dose of 30 milligrams. The lutetium is administered as one treatment every 8 weeks for a total of 4 treatments. Each treatment is 7.4 gigabecquerels of radiation, or if you prefer, 200 millicuries of radiation for each treatment. Following the lutetium-177 4 treatments, patients continued on standard dose somatostatin analog until progression. The primary endpoint was progression-free survival by central radiology review. Next slide, please. So you can see from this figure, Kaplan-Meier curves, that the primary endpoint was met in an extremely impressive fashion. The median progression-free survival was roughly 8 months on the control arm of high-dose octreotide. It has not yet been reached on the experimental lutetium arm. In fact, with roughly a year and a half duration of follow-up thus far, we can see from the Kaplan-Meier curve that the expected median PFS is likely to be longer than 3 years on the experimental arm. This translates to a 79% reduction in risk of progression or death, which is highly statistically significant. Next slide, please. As far as responses, the objective response rate was 18% in the Lutathera arm versus only 3% in the sambostatin arm. I should point out that this is a population of patients, mid-gut neuroendocrine tumors, that has been highly resistant to systemic treatments, at least as far as response rate is concerned, in previous studies. Most studies show response rates in single digits. This is really the only large study that has shown a double-digit objective response rate in a population of mid-gut neuroendocrine tumors. And the difference was highly statistically significant. Next slide, please. There seems to be a separation of the overall survival curves. There were 22 deaths on the octreotide arm versus only 13 deaths on the lutetium arm. The p-value is 0.018, although it's important to emphasize this is the first interim look at overall survival, and therefore the threshold statistical significance is 0.001. So strictly speaking, this is not a statistically significant improvement at this point, although certainly suggestive of improvement in overall survival. Next slide, please. As far as toxicity, the drug was quite well tolerated. This refers to all grades and grade 3-4 toxicities on this table, and you can see that grade 3-4 adverse events were all in the single digits on the lutetium arm. Numerically, the most common grade 3-4 event was lymphopenia, although the clinical significance of this is unclear. I think there was just one opportunistic event, infection event in a patient who was taking chronic steroids and immunosuppressive drugs, so very likely not drug-related. Some of the gastrointestinal side effects, in fact, I would say most of the gastrointestinal side effects are related actually to the amino acid infusions that were used as nephroprotective drugs in combination with the lutetium. The trial mandated use of commercial formulations of the drugs, which are quite nauseating. In Europe, they use modified amino acid formulations, which are much less nauseating. The good thing is that the nausea and vomiting typically resolved once the amino acid infusion was discontinued, and the duration of infusion was roughly 4 to 6 hours. Next slide, please. So to summarize, the NETTER-1 study is the first prospective randomized study of a radio-labeled somatostatin analog. This study was particularly investigating patients with progressive metastatic midgut neuroendocrine tumors. The primary endpoint was progression-free survival by central radiology review, which was achieved with a 79% improvement in PFS, highly statistically and clinically significant. Overall response rate also improved in a clinically and statistically significant fashion. Interim analysis strongly suggests an improved overall survival, which will be confirmed hopefully with final analysis next year. The safety profile of Lutathera appears to be quite favorable, with really very few clinically relevant findings, particularly with respect to the main concerns, which are hematologic, renal, and hepatic parameters. And while there have been few available systemic treatment options for patients progressing on first-line somatostatin analogs, Lutathera appears to have a major therapeutic benefit in this patient population. Thanks.
Thank you, Dr. Strasberg. Lutetium dotatate showed impressive ability to slow the growth of midgut neuroendocrine tumors that had progressed on somatostatin analog therapy. Also notable was that the lutetium dotatate resulted in a response rate of 18% of these tumors, which are typically unresponsive to systemic therapy. The trend to improve overall survival is also encouraging. This tumor-targeted peptide receptor radionuclide therapy represents a new modality of anti-cancer treatment. Well, thank you so much. This concludes our press briefing. Thank you for joining us today. If you'd like to speak with any of our study